Hi guys, my name's Sanjay Gupta. I'm a consultant cardiologist in New York. My lower third graphics don't seem to be working very well today, but I wanted to do a little video on the subject of anticoagulation in atrial fibrillation and the real reasons why the sort of the benefits and disadvantages of using warfarin as an anticoagulant in atrial fibrillation. Why is this relevant? This is relevant because now we have, well, the first thing is, why do you need an anticoagulant? We know that people who have atrial fibrillation have a 5 times higher risk of having strokes. And it is believed that some of that is because of the fact that the heart is not pumping as efficiently as it would normally. In atrial fibrillation, the heart does not pump as much blood out as it would if it were in a normal heart rhythm. And because the blood is not getting pumped out, it stagnates. And because it stagnates, and if you combine that with other conditions such as high blood pressure and diabetes, etc., you can form blood clot, and that blood clot can then get dislodged and go to the brain and cause strokes. And therefore, it is recommended that if you have atrial fibrillation and you have a higher risk calculated by using something called the CHADS2 VASC scoring system, then you should be on an anticoagulant so that your blood doesn't clot. And therefore, if the clot doesn't form, the clot won't go to the brain, and therefore it will reduce your risk of strokes. And we know that if you take an anticoagulant, you can reduce your risk of strokes from atrial fibrillation by about 60%. Okay. Now, the thing is, until recently, the only medication that people used to use was warfarin. Okay. But now we have these newer agents available called the novel oral anticoagulants, or the new oral anticoagulants, or the non-vitamin K oral anticoagulants. And now, because you have this alternative agent available, a lot of people are saying, well, there's this obvious, these new ones, we want the new ones. Why? Because the new ones don't necessarily require blood testing, whereas with warfarin, you have to have regular blood tests. The dose of the warfarin has to be adjusted according to the blood test, which tell you how much of an anticoagulant effect is taking place in the blood at the time. So warfarin is inherently very inconvenient because you have to have regular blood tests all the time, and the dose has to be adjusted accordingly. The newer agents were developed largely to try and reduce the inconvenience associated with the warfarin, because the newer agents don't require the regular blood test. You just take a tablet like you take any tablet, and it'll theoretically just work. Okay, so you don't need to have any blood test. Now, the problem was that because they were inherently more convenient, a lot of patients said, well, I would prefer this tablet, thank you. Because in studies, they were shown to be as good as warfarin. So a lot of patients started saying, well, I'd like this tablet. Now, the problem was that the sort of clinical commissioning groups and the sort of purse string holders felt that they couldn't afford these new agents because the new agents are more expensive, at least on paper, than warfarin. And so now it is recommended that if a person is going to be starting on an anticoagulant, then the National Institute of Clinical Excellence recommends that the GP or whoever is going to prescribe the anticoagulant has an informed discussion with the patient and talks to them about the advantages and disadvantages of both warfarin and these new agents, so that the patient can make an informed decision as to which agent he wants for himself. Okay. Now, the problem is, what happens is, a lot of times, this counseling that happens is not very comprehensive. So the common thing is that people now go out there into GP land to talk to them about the advantages and the disadvantages of the different agents. And the common things that I hear as a doctor is that they come back and they say, well, warfarin requires all these blood tests and it's a bit of a pain, but actually warfarin is around and has been around a while, and if I were unfortunate enough to bleed, I can come to the hospital and someone can give me an agent to reverse the effects of warfarin, thereby stopping me bleeding. That is the advantage and the disadvantage. The advantage is that it's something that I can reverse. The disadvantage is that it's inconvenient. And then they turn around about the NOACs and they say, well, the advantage is that I don't have to have all these blood tests, so it's very convenient. But the disadvantage is that at this point in time, there's no reversal agent. And to my mind, that's not comprehensive enough. And I wanted today to just talk to you about warfarin and what are the real advantages and disadvantages of warfarin in terms of anticoagulation. And I hope that people will look at this video and say, okay, well, I'm at least better informed about warfarin. So there are some real advantages to warfarin. Okay, the first thing to say is warfarin has been around ages, and we pretty well much know warfarin inside out. So it's tried and tested. Okay, whereas the new agents are not as tried and tested. They've only recently been developed. They're still in their infancy. And we don't have 50, 60 years of experience with them to know whether they have any long-term effects or not. That's one real benefit of warfarin. The second benefit is that if you take warfarin, you can do a blood test and you can measure the effect that that warfarin is having on the blood. This is useful for lots of reasons. The first reason is that it'll tell a doctor that the patient is taking the warfarin. Okay, so you can measure adherence by measuring the blood, the INR levels in the blood, and you can measure how much effect the anticoagulant is having by measuring this. The third option, and that's not easily done with the newer agents. With the NOACs, it's not an easy blood test to just go and measure a blood test and know whether you've taken it or not. You have to a large extent, rely on what the patient tells you. So if the patient has for example, forgotten, and they're coming for a procedure which involves shocking the heart, then they may be at a higher risk of complications, i.e. strokes, etc., simply because they may not remember whether they took the medication or not. But with warfarin, you just measure the blood test, you know it's thin, or you know that the INR is good, and therefore you can just go ahead and not worry about causing any harm as a result of the procedure. And the third thing to say is, yes, warfarin is reversible. So if you take the warfarin, you come in, someone says, oh, you need an urgent operation, you can give them vitamin K, and that will reverse the effects of the warfarin. So that's a real advantage. The next advantage is that it can be used in people with all types of atrial fibrillation. It can be used in people with atrial fibrillation which is non-valvular, i.e. the atrial fibrillation that a lot of people have because of diabetes, high blood pressure, but it can also be used in patients who have valvular atrial fibrillation, and the new agents cannot be used in people with valvular AF. What do I mean by valvular AF? People who have mechanical heart valves, metal heart valves, or people who have rheumatic stenosis. Patients with rheumatic stenosis are at particularly high risk of strokes, and the new agents have not been tested in this group of patients, so they are not recommended in patients with rheumatic stenosis. And patients with metallic heart valves need anticoagulations to stop the metallic heart valve malfunctioning. And we know that the new agents could actually be harmful in this setting. And there was a study which showed that the new agents were more harmful than warfarin in patients who had metallic heart valves. So you can't use the new agents in these groups, whereas with warfarin you can. And you can use warfarin quite reasonably in patients who have kidney problems, okay? Whereas the new agents you can't necessarily use in patients who have severe kidney problems. So that's another real advantage. Undoubtedly, it's also true to say that if you are on good warfarin, like if you're on warfarin and your blood levels are nice and stable and within range over 65% of the time, then warfarin in terms of preventing strokes is as good as any other agent. Okay, maybe Not as good as dabigatran 150 twice a day, but other than that, it is as good as any other agent, but provided it's optimal, which is sometimes quite difficult. And finally is the cost issue. And it is, warfarin doesn't cost very much at all. So it's generally considered to be a very cost-effective option, particularly if the patient has achieved stability on it. And those are the advantages of warfarin. And then I wanted to just quickly talk to you about the disadvantages of warfarin. We know that it takes time to work, okay? On average, if you start a patient on warfarin, it can take up to 35 days for their warfarin levels to reach that point where you feel that you are safely anticoagulated. So you are at risk while it's taking this time to work. The anticoagulation can be incredibly erratic. A lot of people come to me and say, oh, they're up and down. My blood levels are up and down, and I don't know why. And of course, when they're very up, you're at a higher risk of bleeding. When they're very down, you're at a higher risk of stroke. And therefore, this big variation can be very problematic. And sometimes it can be difficult for the patient to try and work out why it's so erratic. The third thing is, obviously, they require regular blood testing. And that's a huge inconvenience because on average, from the day they start the warfarin to trying to just get it within range, most people require about 11 separate blood tests, 11 visits to a GP or to a hospital to have the blood testing. So very inconvenient. And the other thing to say is that there are lots of interactions with food and drugs. So you take some drugs, they can affect the effect of warfarin. Foods can affect the effect of warfarin. So those are the disadvantages of warfarin. So hopefully I've captured the main advantages of warfarin as well as the main disadvantages of warfarin, in the hope that you will then be better informed to make your decision as to whether warfarin is the right agent for you or not. I'm going to do another video like this probably tomorrow on the reasons or the advantages and the disadvantages of the newer agents. All right. So I hope this was useful. My name is Sanjay Gupta. I'm a consultant cardiologist. My website is www.yorkcardiology.co.uk. My Facebook page is yorkcardiology@gmail.com, and that's my email address as well, yorkcardiology@gmail.com. I would recommend you look at our More Than Just Medicine channel on YouTube, and please visit our More Than Just Medicine website, which is www.morethanjustmedicine.com. Thank you so much. I really appreciate your comments. I appreciate your views. If you have a spare minute, please send me a message or consider sharing this video with your friends who may benefit from it. And let me know how I can improve things. Thank you so much. All right, bye.